Very good evening, friends. Meeting again in the session of Madra Medica. And today we're going to learn a very important remedy which is very useful in day-to-day acute practice. Wonderful remedy to be utilized many times in ICU also, in emergency. But the remedy is prescribed not as a constitutional. This is not a remedy which is constitutional depicting. It is a remedy. Opium is the remedy which is having an acute action. It used to work for 1 to 7 days and no complementary is mentioned in by Gibson Miller. But there are some complementaries mentioned in the book which I have told you yesterday. That is the nurse drug relationship, and there Nabian has explained alumina, barataga, bryonia, phosphorus and plumbum as a complementary to this remedy. But this remedy is the remedy for the states, different states. There are many single remedy rubrics because it has a remedy, it has action on the human sensorium. Wonderful action on human sensorium, and that's why there are varieties of symptoms which happens to be there and which are unique to the opium. Before going to the Allen's keynotes, I will share 2-3 cases and with a rubric, and that rubric defines the whole state of the case. And that's why I have prescribed remedy as an acute remedy to that specific thing. First case I want to share with you is a case of a student who came to me right from Gadinglas to attend my workshop. It was way back. I have conducted 5 days workshop. There are 4-5 female students and 2 male students who were right from Gadinglas. They came to me, and all of them have asked that after completing 5 days course, we want to attend your OPD at least for a day. And I have permitted them. So it was a fantastic workshop for 5 days, and all of them remained for a day. And next day of the workshop, my OPD was going on, and all of them were sitting with me. And I was discussing many cases, patients were coming, and I was explaining many cases to them, and I was teaching them. In between, I used to tell them regarding the different rubrics, different remedies, actions, all those things. And this was going on right from 8 o'clock in the morning till 1 o'clock. We were too busy. And after completing at the 1 o'clock, we all of them went for lunch. Even I myself also went for lunch. I got some work, and that's why those students who were used to remaining in my students' room, so I had some work with one of the students, so I went up and I looked. I was just asking one student to come over here to meet me, and all of a sudden I have listened the sound of weeping loudly, and the student who she was sitting in front of me was weeping in a big noise. I could not understand. 2 minutes back, she was attending my lecture, my discussion, and it's the whole 4 hours she was okay, and all of a sudden she was weeping. What has happened? I expected something has happened. Some bad news might be there because of which she was weeping so loudly. So I asked other students what has happened to her, and they said, "Sir, she had a very severe pain in abdomen since morning, and she was not able to explain it to you. And she has not told anything to you. But she had a very severe pain, and once she came in the room, she started weeping. This is the reason." So I asked one simple question, that why you have not told me that you had a problem? If you would have said, I would have given you medicine. She said, how can I? You are teaching us very nicely, explaining everything, and how can I disturb you? Yes, it was my duty to tell you, but it not it. I felt that how can I? I felt guilty if I would have uttered, and that's why I have not told anything. But I was having severe pain since morning, sir. So this whole state was there, and she was in agony. So I told the other students what is the rubric. Rubric was very interesting. That she was in agony since 4 5 hours, and she was not explaining, even told me, uttered a single word, that she was in pain, and she was listening and sitting in over there without any complaining. And so what was the reason? Reason was timidity. But for regarding what? Regarding timidity, transacting her business when. Transacting her business. It was her business to tell me that she was suffering from such and such thing, but she has not uttered a single word because she was timid enough to explain that thing. Single remedy, if you open the repertory, you'll get this rubric: timidity, transacting her business when, and only remedy is opium. The whole state revolves around the opium. So I told them that just give her opium and she will be all right. She said, no, sir, I don't want to take medicine. Why? Because I am under treatment of Dr. So and so, and he told that don't take any medicine, and he has given me stramonium, and I am having PCOD, and I was not getting menses since last 2 months. So I said, shall I ask that doctor? She said, okay. So I called him because he was my student. So I called him, and then he said, sir, why do you ask me? It is your duty, you can give, don't worry. I told him this is the state and this is the rubric, and this is the whole state revolving around this rubric. And then she agreed to take the medicine. I have given opium 200, 3 doses. I told her, till tomorrow you'll get the menses. And within 15 minutes, her pain in abdomen was completely stopped with the opium doses. And next day morning, when she was leaving, she was happy. And she called me in the evening. When she reached over there at Kolhapur, she got the menses, and she called me, sir, yes, you told me that I will get the menses. I got the menses. She called me in the evening, next day evening. So this is the opium state. Opium states you have to catch. These are states. Here there is no question of constitution. There is no opium constitution. There is the opium state. And it has been hidden in certain single remedy rubrics, which you have to catch from the patient. So this is first important rubric with which a state has explained. Another case I want to share with you was an interesting case. Again, in the morning at 9 o'clock, one of my old patient who used to remain in Sangamner since childhood, he was my patient, but now he has become elder, got the job at Mumbai, and all of a sudden he came in the morning. So his face was absolutely in fright, absolutely in a fright. So I asked, what has happened? And he was explaining like this, sir, there was something live which is passed in my stools. It is absolutely live. Sir, what is that? He was not aware that worms are the things which passes through the stools, but he was so frightened to that worms. They were worms, but he was so frightened that those pinworms were there, and he got so frightened that whole state was as if he was in a death. He was going to die. He was going to get something else. The whole state was explaining fear extravagance of. It was a state. Here you don't have to give Sina. Sina will not going to work. Here the whole state was expressing, his expressions were explaining about the fear extravagance of beyond limit. It is passing beyond limit. This is extravagant. So fear extravagance of is very typical single remedy rubric of opium. And I have prescribed the opium again. And opium made the change immediately. He calmed down within 15 minutes and he said, I don't know such things happens, and that's first time I have seen such a thing in my stool, and I was so much frightened. So I immediately came to meet you. So this is the second state where I have prescribed opium successfully. Third case was interesting. It's my daughter's case. When she was just 4 or 5 months old, she was premature child, and she it has been told to me by pediatricians and all those that you should not give homeopathic remedy to her. We have to manage her every time. All of a sudden, she got the fever one day. So she was taken to the same pediatrician, and she said it might be viral, and she prescribed her some paracetamol. She got the paracetamol, fever came down, and after that she became drowsy. She became so drowsy that she was not opening her mouth. She has not taken anything inside her mouth, and she has not passed urine for nearly 7 or 8 hours. So we were again worried. So she was again taken to the same pediatrician. She said, we'll give one drip to her. So she has given one drip and she passed urine, and next day morning, all of a sudden she started getting convulsion. And pediatrician, she was much worried now, and she said, you shift her to the Nasik. Then she was shifted to the Nasik. In between, she became totally unconscious. Only one thing was good, that she was, whatever put in her mouth was, she was consuming, otherwise nothing. There was no reaction. She was drowsy, she was having convulsions, and then they have given antiepileptics, and then she was become more drowsy, and they have started considering that it might be encephalitis, it might be meningitis, many things, many investigations were done. Nothing found specific. They said it might be a viral encephalitis, that's all. They have given mannitol to reduce the blood, brain edema and everything and all those things, and she was not responding. Even neurologist met. He said that we have to wait and watch. All things are going on and nothing is in our hand. And at one time, it has happened that her IV was out, and the another hand, the second intracath was, the sister was putting intracath, and there was zero reaction from her. No reaction, no weeping, no crying, nothing, no movement of the hand while putting the intracath in. That moment I thought, forget about the all allopathic medicines, I will give her medicine. I was there in Nasik. I called my student to bring the opium, because it is a benign state of mind and body, which was there. There was no response. There was no sensitivity. Asked him to bring the opium, and he brought the opium liquid 30. I put a drop in her mouth directly without asking anyone. And once I put the drop of opium, after 1 hour, after 5 days, she opened her eyes first time. And within 24 hours, she was reacting in a normal manner. She came out of that benumb state of mind and body with the dose of opium 30, and it works so beautifully. And thereafter, after discharge from that hospital, thereafter we stopped giving her medicine. Then they were have advised that she should take the antiepileptics for 3 years. Within span of 15 days, we reduced it and we finished that course within 15 days. Thereafter, no more antiepileptics, no more convulsion, and nothing till today. Nothing has happened, and she recovered wonderfully without having impression of it on her brain. This benumb state of the body, physique and mind is very important thing which you have to understand at ICU. If patient is not responding, even you pinch the things and patient is not at all responding, think of opium. This is one remedy which brings the sensitivity, brings the life again. So this is a wonderful remedy which we have to learn. So I have shared all those things. Let us go with the opium, the few futures regarding opium from Alan's keynotes. We'll learn few of things today and half of the things tomorrow. Let us open the opium. It is a poppy Papaver family, specially adapted to children and old people, the both extremes of life, like Baretta cup. Baretta is also extremes of life. Specially adapted to children and old people, diseases of first and second childhood like Baretta cup and millefolium. The persons with light hair, lax muscles, and want of bodily irritability. This is very important. Underline want of bodily irritability means want of body reaction. Laxity is there. There is no reaction. Hairs are light. It is not constitution. This is the state which you have to catch. Want of susceptibility to the remedies. The remedies are not working. Even allopathic remedies are not working. They are not showing their reaction. This is the remedy which one should administer, which will stimulate the body. So want of susceptibility to the remedies given in bold has a meaning. Lack of vital reaction. This is very important. Lack of vital reaction. No reaction. The well-chosen remedy makes no impression. So you have chosen very perfect remedy, but it has not producing any result. Absolute no reaction. Think of opium, carbovage, lauroceraceus, valeriana. Very important remedy. Elements with insensibility. So insensibility is very characteristic. There is no sensation, sensibility, and partial or complete paralysis in acute phase of a paralysis. This is a wonderful remedy to be considered. If specifically the paralysis is the result of sudden fright, then this remedy is a wonderful remedy. If epileptic attack is because of sudden fright, opium is one of the important remedy one should not forget. Elements that originate from fright, yes. Fright is very important in opium. Element that originates from fright, whatever it may be. It may be convulsion, it may be acute attack of heart attack, or it might be anything. Elements the origin that originate from fright, bad effects of fear still remaining. So fear, they are frightened away back, but it is not going from their mind. Fear, fright after. Opium is the remedy given. There are two more remedies, aconite and Hasamas, but this is a wonderful remedy to be considered if the fear remains after frightened circumstance. Elements from charcoal vapors, elements from inhaling gas of elements from inhaling gas of drunkards. So this is a very important remedy for many things, where elements are caused because of gas vapors, the elements are caused because of strong smells of liquors, elements which are caused because of fright. All of a sudden, their strong reaction comes out. The remedy is always an opium. All complaints with great sopor. Bold. This is bold. Bold is very important. Sopor. Complete drowsy state. Total. Sopor is complete drowsy state. Painlessness. No pain. That's the thing which I have observed in that case. There was no pain while pricking, painlessness, complaints of nothing. There was no complaint. That is again another important feature of opium. All complaints wants nothing, wants nothing. There was no nothing which is required. So this reaction one must understand. These are the reactions one should not forget. Then it is a remedy for spasms. What type of spasms? Spasms of children. Spasms of children from approach of strangers. If strangers are coming, they get the spasms and body goes into the spasm. Spasms from nursing after fright of mother. Mother is frightened and the infant is getting the spasm. Very, very, very specific. One more remedy is hyoscyamus over there. Yes, hyoscyamus is there. After a fit of anger in mother, then it becomes a chamomilla. It is a naxomika, chamomilla. There is an anger. Mother is angry and child gets, when she feeds the child, she, she feeds the child gets convulsion. Spasms from crying. So when they weep, they cry, there is spasm. Spasms with eyes are half open and upturned. So eyes are half open and they are upturned. Very important feature. These are things which you have to observe. So how is the convulsion? How is the epileptic attack? How is the spasm? You have to observe. If it goes downward direction with clenched thumbs, then it might be ethuja synapium. So here you have to look for your observation plays very vital role. Here the eyes are upturned. Screaming before and during spasm. So before getting the spasm, they screams, they shouts. It is because of brain irritation. It is because of meningitis, epis, leborus niger, meningitis, hydrocephalus. Whenever meningeal irritation is there, the child always becomes cranky and screams. Deep stertorous breathing. This is very important. When patient goes into drowsy state, there is a stertorous breathing and you listen that sound. In nux moschata, it is not there. Stertorous breathing is there with opium. In nux moschata, patient is absolutely drowsy, but there is no such type of breathing. Deep stertorous breathing, both on inhalation and exhalation. So whenever patient inhales, there is stertorous breathing. Whenever patient exhales, there is a stertorous breathing. Delirium, very important feature. Delirious states are quite common. Constantly talking. Patient goes on talking and talking. Eyes are wide open. Face is red. It is puffed. Or sometimes delirium or unconscious. Eyes are glassy, half closed. The face is pale, deep coma, preceded by stupor. So there are different types of state. Either eyes are wide open, either they are absolutely closed. Sometimes they are half open. Sometimes it is flushed face, sometimes it is absolutely pale. You have to look for what type of patient is there. The stupor is marked. The stuporous condition is very much marked. Think she is not at home, like bryonia. Bryonia patient always feels the bryonia says that take her home, even though they are at home. This is a continually in her mind. Thinks she is not at home. This is continually in her mind, like bryonia, and they want to go to home. One more feature, picking of bedclothes during sleep. They wakes up, picks the bedclothes continuously while, if it happens while awake, then it is belladonna and anismus. But if it happens during sleep, then it is opium. And last feature, which we'll discuss today, that it is a remedy for delirium tremens. The people who becomes delirious, frenzy, very much aggressive, specifically delirium tremens happens after the alcohol withdrawal. Delirium tremens in old emaciated persons with blotted face, the stupor, the eyes are burning, hot and dry, with loud snoring. There is a loud snoring. So this state is very typical of the opium, where you can catch, yes, stertorous breathing, the snoring is there, the stuporous condition is there, eyes are half open, So you have to catch those states. The painlessness is there. Benumb state of mind and body is there. Screaming before spasms. The spasms with eyes are half open and eyes are turned upwards. So you have to look for such states. These are all states of the opium. And this is not a constitution. These are the states which you can observe. Basically, this remedy which you can observe many times in ICU. ICU patients, you can get opium state very, very common. Tomorrow we'll continue with this remedy and we'll finish that. I will share one more case which I have treated in ICU tomorrow. Two cases, in fact, both of them are wonderfully cured with the help of opium. So that's all for today. Thank you and good evening, everybody. We'll meet
Thank you
tomorrow
very
at
much,
the
sir.
same time.
Thank you very much.
Thank you, sir.
Good night.
Good
Thank you,
night.
sir. Good night.